Number 1. Recognize their eating behavior as abnormal. Number 2. Rarely suffer serious medical consequences. Number 3. Have positive feelings about their eating patterns. Or number 4. Vomit after eating or use laxatives to purge the food. The answer is number 1. Recognizing their eating behavior as abnormal. This was a moderately difficult question and required elimination of choices based on your knowledge of the two eating disorders, anorexia and bulimia. Bulimics are different because they recognize their eating behavior is abnormal and fear that they won't be able to stop eating. Anorexic clients typically deny they have an eating disorder and appear very proud about their eating behavior and weight loss. Bulimia can cause serious medical problems, as stated in choice number 2, that can result in electrolyte imbalances and esophagitis. Bulimics also tend to suffer from severe depression and isolation. The next topic area to be covered will be on family violence and abuse. Family violence and abuse crosses all socioeconomic, religious, racial, and cultural lines. Victims of abuse are often first seen in the emergency rooms by the nurse. The nurse is responsible to protect the safety and well-being of clients by intervening in suspected abuse cases. The next two questions are related to family violence. The first question comes from Test 3, number 3. It is a fairly easy question. The nurse is working in a busy pediatric emergency room. In which of the following cases would she maintain a high index of suspicion of physical abuse? Number 1. A 3-year-old female with 15% burns in a splash pattern over the face and chest reportedly sustained when she pulled on the tablecloth and a teapot fell, spilling over her. Number 2. A 14-month-old male with many bruises on bony prominences in various stages of healing. The child is reportedly clumsy. Number 3. A 6-year-old with a spiral fracture of the tibia and fibula, which reportedly occurred while riding his bicycle. Or number 4. A 9-month-old near drowning who reportedly climbed into the tub and turned on the water. The answer is number 4. A 9-month-old near drowning who reportedly climbed into the tub and turned on the water. A nurse would be aware that a 9-month-old cannot turn on the water in a tub. A family who reports such an incident would definitely need to be followed up. It is important for the nurse to know the developmental tasks for children, because this information can help you identify what are believable explanations for injuries reported in emergency rooms. And it can also help identify any developmental problems with the client. Every NCLEX RN exam has a question related to the reporting of suspected abuse. The next question is from Test 3, number 13, and is an example of the nurse's responsibility. The question reads, while making an initial home visit, the community health nurse notes several bruises and old burns on a 10-month-old child. Which is the nurse's priority action? Number 1. Call the Child Protection Hotline and report possible abuse. Number 2. Discuss the family with the physician and social worker at the next team meeting. Number 3. Tell the mother that Child Protection will be notified if injuries are noted on the next visit. Or number 4. Carefully record the visit for follow-up. Answer number 1 is absolutely correct. The nurse is obligated by law to report any cases of suspected abuse. The nurse does not need to prove the abuse, but she must report the facts. You should not delay in reporting abuse, as you could be considered negligent in your duties, and any delays could result in death to the victim. The next topic to be reviewed is related to rape and sexual assault. Rape and sexual assault is the most unreported crime of violence in this country. Rape is an act of violence and is unrelated to sexual gratification. The client who is a victim of sexual assault